Hi everyone, today I will be presenting on hearing loss in pediatric patients with cerebral palsy. So to begin, let's break it down. Cerebral refers to the brain and palsy refers to the loss or impairment of motor function. When we combine these two terms together, we get cerebral palsy, which is considered a neurological disorder caused by a non-progressive brain injury or malformation that occurs when the child's brain is under development. This can happen before birth, during birth, or immediately after birth. More commonly referred to as CP, it is described by loss or impairment of motor function. It affects body movement, muscle control, muscle coordination, muscle tone, reflex, posture, and balance. It can also impact fine motor skills, gross motor skills, oral motor functioning, vision, and the topic of my presentation, hearing loss. CP is the most common of all chronic motor disorders in children, occurring in 1 in 500 live births. It should be noted that though CP can be defined, having cerebral palsy does not define the person that has the condition. Possible causes of CP associated with hearing loss include genetic abnormalities, lack of oxygen to the developing brain, maternal infections or fevers, or jaundice, for example. According to the literature, children with cerebral palsy have an increased risk of hearing loss, which is approximately 20% have some level of hearing impairment, with 3.3% of children with CP are noted as deaf. Particularly for children with CP, hearing loss can lead to problems with language and social development. Therefore, early identification and treatment of hearing loss is of paramount importance. We have learned extensively through our education that this early identification and assessment can maximize a child's speech and language development, cognitive development, and psychosocial skills. Now we're going to take a look at the types of hearing loss associated with CP. So children with cerebral palsy may be affected by conductive hearing loss, sensorineural hearing loss, or a combination of the two, which is defined as mixed hearing loss. So just to review, conductive hearing loss affects the conduction of sound through the outer and middle ear. And sensorineural hearing loss results from damage to the neural receptors of the inner ear, the nervous pathways to the brain, or the area of the brain that receives the auditory stimuli. According to War et al., in this study conducted to evaluate the prevalence, type, and severity of hearing impairment in children with CP, it was found that hearing loss in CP has a large degree of sensorineural loss and was noted with a predisposition to be bilateral. It was also found that the severity of the hearing loss often correlated with the degree of the motor and neurological disability of these patients. Furthermore, the literature revealed that among the pediatric population, there is a clinically recognizable genetic cause in approximately 50% of cases with sensorineural hearing loss. In contrast, among children with cerebral palsy, non-genetic causes are more likely, which include hypoxic ischemic encephalopathy, very low birth weight, premature birth, and intrauterine and postneonatal infections. With an earlier diagnosis, it is more likely that the treatment will be effective and will present further language developmental problems. Not being able to hear adequately can lead to delays in all kinds of development, but especially language, speech, and social development. Being able to hear is important to learn to speak and use language. It is also really important in learning how to relate socially to others. Therefore, children with hearing loss that goes untreated, they're at risk for becoming socially isolated. When looking at management and treatment, this depends on the cause. So interventions for hearing loss vary depending on the nature of the impairment and the underlying cause. Possible treatments and solutions include hearing aids, cochlear implant devices, voice output devices, surgery to correct malformations, if appropriate and based on individual case needs, in addition to the medical treatments and forms of assistive technology such as hearing aids and cochlear implants Children with hearing impairments may benefit from speech and language therapy. Children who are deaf or have more severe hearing impairments may need sign language instruction and or the implementation of AAC devices. So in conclusion, the research highlights that early diagnosis begins with a medical history and involves using neuroimaging, standardized neurological and motor assessments. Also, the clinician should understand the importance of prompt referral for diagnostic-specific early intervention to optimize infant motor and cognitive plasticity, prevent secondary complications, and enhance caregiver well-being and satisfaction. The clinician should also be mindful that hearing tests can be more difficult with this population, as children with CP may experience uncontrolled or unpredictable movements. In this case, the clinicians need to be adaptable and make modifications as appropriate. In addition, interdisciplinary treatment is defined as best practice throughout the literature. We should collaborate to build a successful program for the child. So below are just some takeaway points and questions to consider. I want to highlight a few. For example, will the child's hearing aid be adequate for the activity, or should other devices such as FM systems be continued? What about AAC devices? In addition, how will their hearing aid or low vision devices interfere with adaptive equipment and other AAC devices? And here are the references from the literature I reviewed. Thank you for listening and have a good evening.